Good morning, friends. We have discussed regarding the hypersensitivity reactions, and depending upon the mechanism involved in hypersensitivity, we know that hypersensitivity reactions are classified into four types: type 1, 2, 3, and 4. Type 1 hypersensitivity reactions are due to overproduction of antibodies, IgE antibodies, which are having ability to go and bind on the surface of mast cell, leading to degranulation of mast cell and release of mediators. So these mediators affect certain organs and tissues of our body, and then we observe certain different types of the symptoms. So hypersensitivity type 1 reaction, it includes the example like asthma, hay fever, or urticaria, eczema. These are the examples of localized anaphylaxis. We know that anaphylaxis, that is, ana means against and phylaxis means protection. So whenever the response is given by the body, it is against protection. So it is known as anaphylaxis. So anaphylaxis are of two types, localized and systemic. Whenever particular organ or tissues they are involved or their function get hampered, then that type of anaphylactic reactions are localized anaphylactic reaction. That includes type 1 hypersensitivity reaction. So we will discuss the example of type 1 hypersensitivity reaction or localized anaphylaxis. Actually, anaphylactic reactions is example, but in localized anaphylaxis we are discussing asthma and hay fever particularly. So it develops, means localized anaphylactic reactions are developed by inhalation of airborne allergens. Allergens means those antigens which causes allergic type of reaction. So due to inhalation of certain airborne particles or antigens, for example pollen grains or fecal particles, dust particles, skin flakes, these are known to cause asthma. So asthmatic reaction or attack is due to inhalation of these type of the allergen. Some persons, they are exhibiting different or abnormal type of reaction whenever they come in contact with certain types of allergens, which may include pollen grains or animal dander or fecal particles or skin flakes, like that. Some persons, whenever they are sweeping the house, whatever house dust is created, that also inhaled by the person, and they show abnormal or exaggerated manner they are going to react with that allergen. So whenever the allergen comes in contact with such type of the sensitive persons, on first exposure to allergen, the mast cell get sensitized. Means in mechanism we are discussing here, during the anaphylactic reaction, why we observe anaphylactic reaction or why we observe asthmatic attack. Whenever there is a first exposure to allergen or antigen, the mast cell get sensitized. And whenever the same person comes in contact with the same allergen for the second time, so during the subsequent exposure, the mast cell get degranulated and it release mediators. So degranulation of mast cell, it is resulting into releasing certain pharmacologically active mediators. These mediators, we know all of you, histamine, serotonin, prostaglandin, kinin, bradykinin, platelet activating factor, like that. So these are called as pharmacologically active mediators. So upon subsequent exposure of the same antigen, the mast cell get degranulated and it will release certain mediators. So these mediators are responsible for shortness of breath and major symptoms of asthma. So whenever these mediators are releases in the person, for example serotonin or histamine like substances or mediators, these mediators brings about certain type of the symptoms. They affect the respiratory tract and mainly they are responsible for contraction of smooth muscle. So whenever there is a contraction of smooth muscle due to histamine or serotonin like mediators, then the person experience difficulty in respiration. The person experience respiratory distress means there is no proper respiration. There is no proper exchange of pure air and impure air. So pure air cannot go inside, impure air cannot go outside. It means that the person cannot get pure air and therefore the person experience respiratory distress. So that type of the symptom is often seen in case of asthmatic patients. Then histamine as well as prostaglandin, they are responsible for bringing about smooth muscle contraction and bronchioles also, as well as certain toxic enzymes are also releases, and oxygen radicals, cytokines, they are released by eosinophils, and they are going to initiate inflammation. Inflammation means swelling. So there is a increasing capillary and that will result in inflammatory reactions. So these cytokines, certain radicals as well as enzymes which are produced by certain eosinophils, then they are going to initiate inflammation and they are going to bring certain tissue injury. So it means that certain organs as well as certain tissues, their function get affected. So it comes under localized type of anaphylaxis. Then second type of the example of localized anaphylaxis is hay fever. Now we know in asthmatic attack what is the major symptom? Respiration difficulty, or there is a difficulty in breathing, and it is due to the contraction of smooth muscles and bronchioles. So the person exhibit whistling sound during the respiration and he experience suffocation. So he need oxygen at that particular condition. So this is one major type of the symptom of this localized anaphylaxis, or major example which comes under localized anaphylaxis. The second example will be hay fever. Hay fever, it is generally due to inhalation of pollen grains or the typical grass whenever the person comes in contact with typical grass quality. So in that case, the person who is having allergy towards that particular pollen grains or grass like substances or allergens, then person show the symptoms of hay fever. So hay fever is example of type 1 hypersensitivity and is characterized by runny nose, means continuous there is a nasal secretion is there, sneezing is there, and there is a violent sneezing is there, coughing is there, and continuous lacrimation is there, means there is secretion from eye or tears, and itching of an eye. So sneezing, coughing, itching of an eye, lacrimation, these are the symptoms of hay fever. And this type of the hay fever is developed due to inhalation of weed pollen grains. In particularly, hay fever is observed in summer season because there is a, that means high temperature is there, and grass is also get dried, so the pollen grains also become very light, and when the pollen grains are coming in contact with the some sensitive person, then the pollen grains are automatically inhaled, and after inhalation of these pollen grains or weed pollen grains, I mean to say, the respiratory tract get mainly affected, and when respiratory tract get affected, the person shows symptoms like sneezing as well as coughing, or excessive mucus secretion is there, and lacrimation or tears from the eye. So that type of the symptoms are seen here. Nasal mucosa and upper respiratory tract get mainly affected due to this allergen. Allergen means this weed pollen grains. And whenever the person comes in contact with weed pollen grains for the second time, the first time mast cell gets sensitized. Whenever the person comes in contact with the weed pollen grains for the second time, then there is a release of mediators by mast cell after degranulation. And these mediators bring about itching of an eye as well as flowing of tears and runny nose, sneezing and coughing, etc. So these typical symptoms are seen during the hay fever. So asthma and hay fever, these are the examples of localized anaphylaxis, no doubt, but this is due to the allergen including weed pollen grains or other type of the pollen grains, or dust particles or animal dander like allergens. some persons they show allergy towards certain food items or food particles. So that is comes under food allergy. Means what happen when the person consume some type of the food material, for example egg and egg products, or milk and milk products, or wheat products, as well as shellfish. So that type of the sometimes strawberries also. So these are the food allergens. Means what, whenever the person consume this type of the food material, he may show certain different symptoms. For example, he may suffer from gastrointestinal problem, or he may suffer from abdominal pain, or there is a no proper digestion, there is a vomiting or diarrhea. So these type of the symptoms can be seen after consumption of these food particles. So that comes under food allergy. Means whenever the persons they are showing the allergy or they are exhibiting hypersensitivity towards certain food particles, then it is called as food allergy. Means these food items should not be consumed. If we want to avoid this, we have to avoid the consumption of these food particles. When some food items are consumed by individual, he exhibits certain abnormal reaction like gastrointestinal disorders. Means there is no proper digestion of the food material, or the person may suffer from abdominal pain or abdominal cramps, as well as diarrhea or vomiting, like that. So there is a nausea. So these symptoms can be seen after consumption of food material, some food material, not all. So food allergens may include eggs, milk and milk products, shellfish, like that. Whenever the person drink milk, or whenever the person consume milk products, or whenever the person consume egg and egg products, or a shellfish like food material, then he may show some abnormal reaction if it is having the allergy towards these allergens or towards these food items. So one thing we can do here, if we want to avoid the allergy in case of food material, the best way to avoid the consumption of this food material, if we know that we are having the allergy towards for example egg or towards this particular milk product, then we can avoid this by avoiding the consumption. So this can be done in case of food items, but in certain allergens we can't avoid the contact also. Naturally the inhalants or the dust particles get inhaled also. So better way to use mask, or better way to use handkerchief to avoid the entry or inhalation of the dust particle. We can do to some extent the avoiding this type of the allergens. But in case of food allergens, we can avoid it by avoiding the consumption only. So this is one way we can avoid the food allergy. These food particles brings about sensitization of the master cell and release of mediators. So this is regarding the food allergy and hypersensitive type of 1 reaction, including asthma and hay fever. Then how this can be diagnosed? If we want to diagnose, if we want to determine particular allergic reaction, how we can diagnose type 1? So for this diagnostic test, we can use skin test. So mainly skin test is used for diagnostic type 1 reaction. Here the antigens are injected intradermally at various sites on the forearm. So when we want to test allergy towards particular antigen, we can inject the antigen in the body, or especially in the forearm, and after some time period, means after 20 minutes or within 1 to 2 hours, you can say, we can observe typical wheal and flare reaction there. Means if there is a swelling or redness, that type of reaction we can observe at the site of injection. So if we observe redness or swelling at the place where we have injected the antigen, then we can determine the person is having allergy of that particular allergen. So if the person is really sensitive to allergen, then the mast cell in that particular localized region of the skin undergo degradation, and the mast cell there only they get producing certain mediators, and due to mediators we observe typical wheal and flare reaction. So what is this wheal and flare? The wheal is the central area of puffness which is surrounded by flare, and the flare is a red in color due to erythema. So there is a excessive production or accumulation of red blood cells, and due to which we observe redness along with the surrounding the flare. So this is called as surrounding the wheel. Wheel and flare. Wheel means central area which is slightly swelled or inflamed, and it is pale in color somewhat, and it is surrounded by the flare. Flare means it is red in color due to erythema, or there is excessive accumulation of RBCs, and due to which we observed erythema. So it is called as wheel and flare reaction. So at the site of injection we observe this after some time period. That is the one type of the test we can do in order to test allergy. Then how to control type 1 hypersensitivity reaction, means how to avoid or how to make control on this. What is the remedy in brief we can say? So one thing we can do here, avoiding the exposure to allergen. If we know that I'm having this allergy towards weed pollens, or I'm having allergy towards such type of the pollen grains or certain grass type, then we can avoid the contact. So by avoiding the contact with the allergens, we can avoid or we can get control over type 1 reaction. So one individual, if he is having or if he knows that he is having the allergy towards allergen, then he can avoid the contact of this particular allergen. The second way to get control here is desensitization. Means here allergen is injected regularly for a month in increasing concentration through subcutaneous route. So due to injection of this allergen regularly, the desensitization will be there. Sensitization of the master cell means mast cell gets sensitized and release mediators. Desensitization means there is a we are going to indirectly we are going to nullify the function of this master cell. So there will not be release of the mediators. So we are going to stop the release of mediators. If we can stop by injecting allergens for a month by subcutaneous route, then it will be in control. There will be no further release of the mediators. So in this way we will not observe any allergic type. Then second one is the use of monoclonal antibody. We know monoclonal antibodies are very specific and they are again the single antigen determinant, so they are very specific in their action, and we can use monoclonal antibodies for in order to lower the IgE concentration, because we know that in mechanism we discussed that the anaphylactic reaction or type 1 reaction, hypersensitivity reaction, is due to overproduction of IgE antibodies. Basically, concentration of IgE antibody in the serum is very less, and in case of allergic person or the person is having allergy, in that condition there is a maximum or overproduction of IgE antibodies. In case of asthma, we can say that in some families there is this asthmatic condition is there, means parents are also having allergy to a certain allergens and they suffer from asthmatic attack. Similarly, their offspring also shows the same type of the symptom, or they may have the allergy towards the same type of the allergen. So why is it so? The characteristic of overproducing IgE antibody is inherited, and due to which the offspring also shows some type of the similar symptoms with their parents. And such type of the allergy runs in the family. It is also called as atopic type of the allergy. So that is that also we can say. So overproduction of IgE antibodies, this character is particularly inherited in certain families, and therefore in certain families we observe the typical allergy or same type of the allergy. So here by using monoclonal antibodies we can lower the concentration of IgE antibodies to some extent. So if we use specific monoclonal antibodies, then these antibodies, what they are doing after injection in our body, these antibody they are going to lower, they are going to help to minimize the concentration of IgE antibodies. If IgE antibodies are less or if their concentration will be decreasing, then IgE antibodies will not be available to bind to go and bind on the master cell surface, and if they are not going to bind on the master cell surface, there will not be any degranulation and there will not be any release of mediators, so there will not be allergy like that. So in this way, we can use monoclonal antibody to lower the concentration and to control indirectly over the type 1 reaction. Then the next remedy or next type of the control include the use of drugs. Certain drugs, or you can say certain antibiotics, they can be used to control type 1 reaction. For example, disodium chromoglycolate and theophylline. So ephedrine, theophylline, these are the drugs, chemical substances actually. These are the drugs which can be used to control type 1, because what happens, these drugs, they are going to affect the activity of mediators. For example, histamine is there, so histadrine is one type of the medicine. Histadrine will be going to affect the activity of histamine. So histamine is actually vasoactive amine and responsible for smooth muscle contraction, we know very well. So if we use such type of the drugs which can affect or which can antagonistically act and which can inhibit the activity of mediators, then we can control over the hypersensory reaction. So if even though the mediators are released, their activity will not be there in presence of drugs. So we can use drugs. So drugs, they are going to inhibit the activity of mediators. So if the activity of mediators is inhibited due to drug, there will not be any allergic symptoms. So use of monoclonal antibody, use of drug, desensitization, these are certain types of the remedies, or these are certain medium, you can say, control measures in order to avoid the allergy. Thank you.